Well, so I think that any woman getting started on HRT has to consider and be very honest and truthful about their medical history. The biggest risks that we worry about really are the risks of cancer, the risk of developing a blood clot. When we take our female hormones into account, estrogen itself, whether your body is producing it on its own or not, it's what we consider a hypercoagulable hormone. It can cause the production of blood clots. And so if someone has a medical condition that makes blood clots more a possibility for them, maybe they have a hereditary condition or they've had medical problems in the past, then that's something that we have to discuss and really discuss whether or not this is worth the risk or not to them. A lot of women worry about breast cancer as well. That's probably the biggest, most popular question I get from patients when they're considering starting treatment. They want to know, if I start HRT, am I going to develop breast cancer? And the fact is, no. Women actually die in greater numbers and more frequently from heart disease than they ever do from breast cancer in the United States. But all we really hear about is breast cancer awareness. Meanwhile, if we take estrogen, it actually helps to be cardioprotective and it protects the blood vessels and the muscle of our heart. So it actually has benefits to protect against the biggest killer. Like I said earlier, this is gray area. Medicine is not black and white, and each patient is a unique individual.